Hello friends. Emergency pills are among the fastest moving products in the community pharmacy. And from experience, you may find that you are serving a lady close to 3 times in a week. The same lady taking the same emergency pill. Now, something to note, these emergency pills contain a high level of the estrogen hormone. Estrogen is good, but in high levels, it prevents either fertilization, the sperm meeting the egg and then causing fertilization, or it can actually prevent implantation. Meaning they're actually good. Yeah, we need them in certain cases. We need them when perhaps your loved one has visited you abruptly and you have intercourse. You're not ready to have a kid, and then you take the morning after pill, we call them emergency pills, to prevent the pregnancy. Now, assuming you stay with that lover of yours, maybe for a week, and on a daily basis you have intercourse, do I take these emergency pills every day whenever I have intercourse? Well, to put it on record, emergency pills work up to or work within 72 hours. You have a window within which it can guard you against getting pregnant. So, but it's also important to underscore that the earlier you take it after intercourse, the more effective it is. So if you have had intercourse today, it's important that you take it after the intercourse. Not after every round, but after the entire session. There is also a misnomer where ladies, after knowing that it works up to 72 hours, they have intercourse today. Case in point, today is a Thursday, they have intercourse. Thursday, they have intercourse. Friday, they have intercourse. Saturday, and then they take it on Sunday morning. There it will not work. Or they take it immediately after the 3rd day of having intercourse. It will not work. Yeah, like as I said, the intercourse that such a person had on Thursday, it would have clocked the 72nd hour by end of Saturday. It would mean that the chances of getting pregnant resulting from the intercourse of Thursday is actually greatest. So there are instances when you are going to get pregnant. So that needs to be very clear. Now, does that mean then that do I need to have emergency pills every day whenever I have intercourse? Reliably, I would say yes. However, it comes with consequences. And I would like to just highlight 1 or 2. Yeah. 1, like as I said, they have a high concentration of these hormones. So when you take a high concentration of these hormones, it can actually alter the normal menstrual cycle of the lady. There are cases when I see ladies present either having continuous bleeding that does not stop, or they do not have this bleeding. It's because there is an alteration in their normal menstrual cycle. And the number 1 cause is actually the emergency pills. They are good. There's a reason as why they are called emergency. In cases when it's really an emergency. In case when you are with someone, you plan ahead. You can use other alternatives like condoms. You can use your safe days in case your days are regular and you can ably monitor. You can come in case you are not certain. We guide you on how to count your safe days and the unsafe days. So the number 1 point that I want you guys to, all the ladies, to capture vividly is that when you take so often these emergency pills, they are going to alter your normal menstrual cycle. You may not go into the periods, you may delay, or you may stay in the periods for quite a long period of time, which is not good, by the way. Yeah, it can actually affect your quality of life. Number 2, time comes when you want to give birth, but when these emergency pills have actually caused what called temporary, I'm using the word temporary deliberately. Why? Because emergency pills statistically, or from evidence or from research, they do not cause infertility, but they can cause temporarily, inability to conceive. And that really happens because of the changes in the normal hormonal cycle. However, you can give it time. There are those that have taken more than a year to get back to their normal fertility levels because of just the emergency pills. So, in a nutshell, I would like to say this categorically, that emergency pills are important. Reason being, if you are not ready to have a kid and you have had intercourse with someone and you're not ready to be pregnant, you can use them. 2, you're not supposed to use them every day whenever you have intercourse. Why? You are pumping your body with a high dose of this hormone, and it can actually predispose you to having imbalances in your menstrual cycle. 3, it can predispose you to not getting pregnant at a time when you want to because of the changes in the fertility. But I need to highlight that does not cause infertility. However, it can delay the fertility of the lady. It does this by preventing the release of the egg. Yeah. So the correct way to use it after having intercourse, at least within 72 hours. The earlier, the better. But in a month, you shouldn't exceed 3 emergency pills. When it's more than 3, it sees as being an emergency. It is a routine. And for the case of the routine, we advise you to use other methods that are relatively safer, even cheaper. Because, put it in figures, on average, an emergency pill costs between 5K to 10K. So, if you're to have maybe 3 intercourse in a week and you're taking an emergency pill, let me consider the cheapest option, 5K per pill. That is 15,000 every week. Put it in a month, 15 times 3, that is 45,000. So if you're to be with someone for a long period of time, choose cheaper options, which are even much more advised, like perhaps having an injector plan, which can last you 3 months. And it is really very cheap. In community pharmacies, now like here at Masapharm, it's only 5,000 and it takes you for 3 months. But if you're going to be with someone for a longer period of time, you're going to have kids, you're going to start a family, you would wish to have child spacing, you do nowadays to plan the kids. In such a case, there are other methods, the likes of implant. There are those for 2 years, there are those for 5 years. They are what you call rings of water, IUDs. Yeah, you just insert it, it protects you against pregnancy, and whenever you want to get pregnant, you just remove, and then you get pregnant. Yeah, so I would like you to judiciously or to consciously use these emergency pills to make good use of them, but then also putting your body in a good state. I thank you. In case of any questions, kindly hit or comment in our comment section. In case you find this resourceful, share with your friends, share with your guardians, share with your relatives, and we look forward to engagement. Feel free, ask questions. We shall create the time and answer. Thank you very much.